I want you to move from overwhelmed by information to confident in what really matters. I want to help you move from being unsure towards direction and purpose in your healthcare. I want to introduce you to health experts. I want to let you in on tough conversations on women's health. I want to give you a place where you can lean in and learn how to take care of yourself. Let's transform your health. Let's get clear on your goals. This is Women's Health Unplugged. I'm your host, Dr. Jordan Robertson, Naturopathic Doctor. Welcome to another episode of Women's Health Unplugged. I'm really excited for us to have this conversation today. We are discussing a topic that we really haven't spent quite enough time on in the podcast over the last couple of years. I have invited my friend and colleague, Dr. Ashley Chauvin, who's a naturopathic doctor at my office in Clarity Health in Burlington, Ontario, to talk to us today about not just the risk factors and how to have an active role in the prevention of breast cancer, but also to talk about what we can offer women as far as their ability to support themselves during survivorship. And I'm really excited to have this conversation. Ashley, thank you for joining me on the podcast today.
Thanks for having me.
When you and I met, Ashley, we talked quite a bit about your sort of, your journey to getting where you are in your career now. And you've really spent the bulk of your career working with women at some point in time during their cancer journey, whether that's through prevention, women who are in active care. And in active care, I mean like deeply in the throes of chemotherapy and radiation, but also working with women to thrive in survivorship. And I remember you used that term when we first met. You said, what I love is, and what I'm passionate about is teaching women how it's possible to thrive post breast cancer. So I would love if you could kind of walk us through your personal journey to getting to where you're at in your career now, because that speaks volumes to why you've chosen this path. It's going to really set the stage for the rest of our conversation.
Yeah, so I went to school originally for radiation therapy. So for all of you who don't know, that's to work with patients during cancer care, radiation. And during that time, I really enjoyed it. I actually really loved working in the hospital environment, which a lot of people are surprised to hear as a naturopath. And I got to know patients. I was also really grateful that one of the doctors at the clinic took me on, and she allowed me to come into visits with her. And we also talked to patients and did follow-ups with them. And that was one thing during radiation therapy school that I was missing, is a lack of follow-ups. We would just treat somebody, they ding the bell, and then say goodbye. So I got to see people at 3-month follow-up, 6-month follow-up, and even year follow-up. And there were these huge gaps in care where patients would come back and they would have concerns that maybe they weren't sure if this was related to radiation or something completely different, like arthritis, and could it be the medication or could it just be their lifestyle? And the oncologist admitted it's kind of outside of our scope of what we're doing. So when I questioned her about it, she said, there's a job for that, and it might be functional medicine that you're after. So that led me to go to the Canadian College of Naturopathic Medicine with the intention of working with patients with cancer. And here I am.
And so here you are. Okay. So basically, like, their shortest follow-up was this sort of like 3-month gap. And we can kind of imagine, and if our listeners are listening and they've experienced a diagnosis of cancer, maybe they can relate to this. But, they basically released back into the wild after their treatment and said, like, don't worry, we'll check in on you in 120 days. And yet, like, I'm imagining that that's a relatively isolating experience for those people and women to be sent home to just, not only deal with all of their questions on their own, but also to like you said, like trying to figure out what's caused, like what's from what.
Yeah. And if we really think about it, those women for a very long time, sometimes up to a year, have had check-ins with a medical professional, regardless of who they might be, maybe as soon as every 2 weeks during radiation, every day. They've been able to ask some small questions, if not have larger conversations during that time. And suddenly it's like, oh, well, maybe we'll see you in a month or 3 months. And yeah, nothing.
Okay. So I want to talk about survivorship and how we can help women thrive after a breast cancer diagnosis. But let's go back to the actual beginning and talk about like why this is such an important topic for women. And I think it's interesting is when we ask women what some of their greatest health risks are in their lifetime, they often will cite breast cancer as being one of their concerns. Whether or not that's accurate, breast cancer certainly doesn't top the list, but it's up there as far as our lifetime risk as far as concerns are in women's health. Can we like back up a little bit and talk just about what the risks are for women as far as breast cancer? Do we know what a woman's sort of lifetime risk is and what some of those things are that she can control that will influence whether or not she develops breast cancer?
So, risk factors can include genetic. So, whether or not a family member, male or female, has had a history of breast cancer, early menstruation, and late menopause. Other risk factors that are more lifestyle are weight and blood sugar dysregulation, decreased physical activity, and alcohol consumption. Those would
Alcohol
be.
consumption. I feel like that's such an important piece of the conversation. And we've talked about this, and I want to kind of come back to some of those other risk factors that you've mentioned there. But it sounds so, I think when we talk to women about breast cancer and their risks, like, I don't know, like there's almost this idea that there's like certain things that we can't control. And so for those of you that are listening, we would maybe call those like, well, we do call those like non-modifiable risk factors. And those are things like your genetics, right? So there are some like really strong genetic forces when it comes to breast cancer. Am I right there, Ashley?
Absolutely. Like BRCA1, BRCA2.
Right. And then there's like the modifiable risk factors, which are the things that are within our control. And I think that's what patients are kind of like eager to understand and want to know what their actual, like, what their actions and kind of influence their actions are going to have on their future cancer risk. And when we talk about modifiable risk factors, those are things that you can influence by your actions and the things that you kind of do every day. What's your thoughts on alcohol? I have very strong opinions about alcohol, so I'm going to let you go first, and then I will I will come in second. But for the women who are looking to have like a huge impact on their future breast cancer risk, or maybe they know they have some risk factors that they can't control, like where do you stand on the concept around alcohol?
So my thoughts have definitely changed over the years. Maybe it's because I'm not bartending my way through naturopathic school again. But what I will say is that I can't deny the evidence and I can't deny what I see, right? So having 1 to 2, I would say even having one serving of alcohol from the Mediterranean diet, there's, that research kind of says it's okay. However, we know that wine or alcohol in general disrupts sleep, which is a risk factor, disrupts blood sugar regulation, adds those extra calories. So it's truly a carcinogen. So it does lead me to have a conversation with people and to really look at the alcohol consumption that they're having.
I remember when the WHO like reclassified alcohol as a class 1 carcinogen, right? And so patients are often like surprised to know that alcohol is classified as the same degree of carcinogen as smoking, right? Where we women say, well, no, I don't smoke. And or I've worked really hard to quit. I knew that that was something that needed to go. But alcohol is actually classified as the same level of carcinogen according to the World Health Organization as smoking is. And I was at the North American Naturopath Oncology conference like the month after they made that change. And I feel like we spent the entire time at our little lunch tables talking about how on earth we were going to break it to our patients that this was like one of the biggest deals that they could make as far as like changing their health patterns and behavior to influence their cancer risk and their future cancer risk if they had already been diagnosed with cancer one time in their life.
Yeah, it's definitely a conversation that we need to have more of, especially when the women that I work with from a prevention of recurrence perspective are so highly motivated, right? They're willing to do everything. They're getting rid of all of the shampoos that they have. Where, a lot of patients are going down rabbit holes and asking, what in my life can I change? And I'm not saying there's no point to throwing out all of your shampoos and getting a new mascara if you're going to have, 2 to 3 drinks a night. But I think we really have to weigh that when we're looking at these risk factors and from carcinogens. We can't, I guess, pick one and not understand the other.
Right. Like your shampoo is probably a drop in the bucket, right? As far as like cancer risk goes, when there's like a major carcinogen that like lives in most women's diet.
Absolutely.
That we have like known evidence for is a problem. Whereas the shampoo, it's like, okay, we've seen in like some rabbits that maybe it's not a great idea for them. And we'll make an assumption that it's not as good for women. And that I think speaks volumes to like some of the information that women find online about what they should or shouldn't do when it comes to cancer care, which I definitely want to talk a little bit about. But coming back to like the blood sugar piece, weight management, BMI, like how influential are some of those pieces on helping women prevent breast cancer?
Well, according to the evidence, they're very important. And I would say also when I'm working with women for prevention of recurrence, the side effects that they're experiencing tend to be much less so when their weight is at, a normal BMI, when women's blood work in general, in terms of their fasting insulin, fasting glucose, is within normal limits, when their cholesterol is good. We also have to recognize that patients who have went through breast cancer treatment do have a higher risk of issues with their bones and issues with their heart. So when we're being mindful of blood sugar regulation and inflammation, that can also impact the risk factors for those other comorbidities.
Right. Because even just the exposure, like going through, like we talk about like chemotherapy and radiation, and even just like being diagnosed with cancer means that we're kind of at increased risk for some of those pieces.
Absolutely.
So if women are looking for ways to, and so I'm talking like strict prevention here, for the majority of our listeners who are thinking about breast health, who are thinking about how to best support themselves. I mean, I guess first I'm curious about what your thoughts are around self breast exam, because to me, I feel like, I don't know how I feel about it. The evidence was not particularly keen on women doing self breast exams. And yet it really felt like we lost something from women being in touch with what's going on with their body when we stopped encouraging women to do self breast exams. But what role does that play? And then how can women sort of construct a prevention plan? Like, what does that actually look like?
So I'm probably, my family is interesting. My family doctor actually had this conversation with me and asked me if I ask women to do self breast exams. And because the evidence does say that if we do it, we're, I guess, over giving more people mammograms than necessary. Having said that, there's a lot of women that aren't eligible for mammograms and they're finding their own cancer. So to me, I'm not paying for the mammograms. And I also believe that women should know their bodies. They should know they're normal. If they feel something or their partner feels something that's outside of the normal, then they should bring it up to their doctor. And with virtual care now, we have to say there's a lot less physical examinations going on.
Mm-hmm. Mm-hmm.
So, I've had plenty of women that have come to me, and I always ask at the beginning of the visit, how did you find out? And more women actually tell me that they found it or, a partner found it than a mammogram did. So we also have to assume too that people are going for regular screenings. And I don't know about your patient population, but not all of my patients are going for regular screenings. It's something that we talk about. So if in the interim they're they're going to get to know themselves and they're going to get to know their normal and their abnormal, then I'm all for that. If there's a couple of extra mammograms, then there is. Maybe not most evidence-based thing to say, but that's been my experience in my practice.
Yeah, like I feel like, and you bring up such a good point with the pandemic and like the lack of physical exams. And even I was thinking this week, like there was a couple of patients that I worked with this week where I was like, has anyone like looked at that? Like actually looked at it, not like because you took a picture and uploaded it somewhere. Um, so you're right. Like with the lack of like actual physical in-person appointments over the last year, it'll be interesting to see if we reevaluate the importance of women doing self-breast exams and where that like sort of whole, and I'm saying this for our audience's benefit, not ours, but like the reason that we don't want to over screen is that we end up over biopsying and we end up over stressing and we don't find that much more cancer, right? Like that's where recommendations like this come from. It's that we found that, we weren't necessarily catching more positive cases, but what we were doing is we were biopsying a whole lot more negative cases, and that the trade there was not particularly good. And so then we stopped recommending self-breast exams. But you bring up these really good points where women are not having in-person physical exams right now, or at least haven't in the last 18 months. There's lots of women who are not eligible for additional testing or screening, or like mammogram would not become accessible to them unless we felt like there was a reason to mammogram them. And there's so much misinformation online about the concerns around the radiation from mammogram, and that women are maybe not even going for mammograms when they are offered. And so is our fallback better that we have those women actually understand what their body feels like so that they could be alerted if there's change?
Yeah, and during this time, plenty of people have missed regular screenings because it's been considered non-essential. I mean, I feel in a lot of ways the medical system has hit a pause button, but people's ailments have still continued. So,
yeah, and I don't like quoting statistics, and I'm not going to try to, but I recall reading over the last 6 months that our actual like diagnoses of cancer have dropped over the last year. And so it looks like on paper that our incidence is lower, which we know it's not, right? It's that we just haven't found them because those people have not attended regular appointments.
yeah,
Which I'm sure we'll be dealing with that for a long time.
absolutely.
And so part of it, so I'm glad to hear you say that you're in for self-breast exams, and I'm not into over poking and prodding women. I'm always wanting to be much more practical about that. We got lots of kind of interesting feedback after I did a podcast on cervical screening when I said, you don't need to go as often as you're going. And everyone was like up in arms about, but we don't want to biopsy and check women more often than we should, right? Because that's not positive to just check. But I share your perspective, right? That I think there's also value in women. And funnily, in my patient population, when I ever work with a woman who's experienced breast cancer, she found it too. So whatever the evidence says, the women who walk through our door appear to have found their own breast cancer a lot of the time.
Yeah.
Mm-hmm. So screening is important. And from a mammogram perspective, my general consensus or my general thoughts are to just have women go as prescribed by public health. And what are your thoughts on that?
Absolutely, as prescribed by public health. And that can also mean if there's an incidence in your family, people are offered mammograms, MRIs, or ultrasounds even sooner. So speak with your family doctor or public health guidelines for that.
Yeah. And that's usually what I like. If I tell women, like, if you get a letter in the mail, right, it's because we have figured out that it is a really good idea for you to go, right? We're not trying to scam you to make money or do anything sinister. If you got a letter in the mail, go.
Absolutely. I'm not scared of mammograms. I recognize that they're uncomfortable. I'm not going to dispute that. From a safety perspective, though, the amount of radiation that you get is very, very, very little compared to, I think, what people feel like they're getting. I remember in radiation therapy school, and this could be I went very many years ago, so this could be very, very outdated. But they were comparing the amount of radiation that you'd receive from a mammogram, CT scan, an X-ray, to flying on a plane, to photocopying things, to drinking. The amount of radiation in beer was listed. So I think that's also what we have to remember, that, well, most of us aren't jumping on planes now, but if you're someone who has no problem jumping on a plane 4 times a year, and that's me, I love to travel, then I also can't say, well, then I shouldn't be going to get my mammogram because I'm worried about radiation.
Right. Right. And thank you for bringing that up. That's such a important point to contextualize it, right? It's and it's similar to that alcohol conversation. People are like, I want to do whatever it takes. And I'm like, okay, well, you need to cut back on your wine. They're like, not that. But as far as what we understand when it comes to diet and prevention. So again, we're still sticking with the full on, how do women develop a health plan that is trying to help reduce their risk of primary cancer as much as humanly possible. What do we know for sure about nutrition and cancer prevention?
Yeah, the key word is balance, right? So when it comes to prevention, I would say if I had to pick a diet, and I hate putting labels on things because there's always room for improvement, and paleo to one person means paleo to somebody else, even amongst articles. But I would pick a Mediterranean diet approach. So we're looking at recommending 5 servings of fruits and vegetables a day, which doesn't sound like a lot when I'm speaking to people. But when we really if someone is writing that down, you can really see that maybe we're not hitting those servings as much as we want. We want to have adequate protein consumption that's coming from fish, turkey, chicken, our white meats preferably, limiting red meats, but still keeping them in their diet. Grass-fed is best, but I know that's not available to everybody. Legumes are definitely safe. Soy is encouraged and safe. Can I say that again?
You can, and maybe louder.
Soy is encouraged and safe. It has been heavily studied in before people who are premenopausal and postmenopausal, in breast cancer with estrogen positive receptors, and all the evidence shows that soy is safe. Soy milk and tofu, if you can tolerate it, is also a great source of vegetarian protein. And many people are not hitting protein adequacy, which is also very important from maintaining blood sugar balance and healthy body mass. Muscle mass is very protective. So I highly encourage vegetarian-based protein as well.
Let's go back to the soy thing for a second.
Okay, sorry. I know I got
No, it's okay. I'm like, wait, hit pause. We got to go back to that. I've actually lost patients over our disagreement over soy, where I was like, yep, it's good. It's great. And they eventually came back and were like, I can't work with you because you think soy is safe. And so I love that you brought it up. And the way I always put it to women, I'm like, you know what? I don't mention cucumbers anywhere in your treatment plan because they're neither here nor there, right? We don't care if you eat cucumbers or don't eat cucumbers. We don't mention it. Irrelevant. Why would we mention soy if there was a scrap of evidence that it was even neutral, let alone negative, right? If it was net neutral and had no impact, it would be in the cucumber pile. I wouldn't care. I wouldn't bring it up. If it was negative, obviously, we wouldn't add it to your treatment plan. And so, obviously, by process of elimination, the evidence must be pointing in a direction that is a lot more positive. How do you handle that conversation?
So I handle that conversation the same way I talk about cruciferous vegetables. So that's our broccolis, our cauliflower, cabbage, which also, are very, very good for patients to eat as well. But having said that, I recognize that that's one piece to the puzzle. So I like to empower people. I like to say, I'm giving you the best evidence I have in this moment, knowing that in 2 years it can change, although soy's been pretty decent for a while. And if it's causing you gastrointestinal problems, right? Like if you have soy and your stomach really hurts, then don't have it, I guess. But, try it at least. Try to make the effort. And if people really don't like the taste of it, I also put it to the sense of this is like a medical, this is the same way I'm asking you to take a B complex or a magnesium, right? And if you still don't like it, fine, don't do it. But it doesn't mean it's not good for you, right? So just because you don't want to eat 5 servings of vegetables a day doesn't necessarily mean that it's not important. It doesn't mean you shouldn't
Right.
do it. You can choose to do anything. You can choose to do everything, or you can choose to do nothing. It's up to you. It's up to the person in front of me, really.
Oh, that's a much softer way of putting it. I feel like I'm getting crotchetier in my old age. But I like the way that you put that, because you're right. Like that does come down to being, that is a personal decision. Now, if you don't want to include soy, that is not the medical decision. The medical decision would be to do it.
Yeah.
Okay, I'll let you finish your conversation around diet, since I totally sideswiped to come in there to talk about soy. Was there anything else that can be included as part of that Mediterranean diet? I heard you say fruits and veg, which you're right. Like the practicality of fruits of 5 servings is not always easy, and patients often find it an annoying amount of fruits and vegetables. The legumes, the leaner protein cuts. Is there anything else?
Whole grains are okay. I think that's pretty much what I should mention is that if you are not celiac and you have a piece of sourdough bread, the world is not going to collapse. You will be okay. It is not the piece of sourdough bread that is going to cause a recurrence in cancer. At least I've never read anything or seen anything clinically to prove that.
Yeah,
So
go ahead. Keep going.
I think we just need to be mindful that there's very strict diets out there, and people have found them to be beneficial for maybe themselves or a small percentage of the population. But I am working with the person that's sitting in front of me. So, for example, when we talk about a diet such as a carbohydrate restricted diet, I have to be really mindful if the person is sitting in front of me is even eligible for that diet and any modifications that we need to have. So I don't think there's one particular diet for everybody. That's why I like including the principles and what's going to work for them. The second thing is sustainability. Doing a juice cleanse for 2 weeks is not going to make a difference. But if you're eating a little bit of vegetables daily, that's great. Training like you're training for a marathon for 2 weeks is going to have a little bit of an impact, but making sure you're getting your steps in daily for a long term is going to make much more of an impact when it comes to your prevention plan. So I like to work with patients to choose things that are sustainable and look at their challenge points and then build from there, knowing that I want my patients to be with me and to live very, very long lives. So we don't need to fix everything in the first visit. We're not going to fix everything in the first visit. So I think that's important for people to know when they're choosing their prevention plan.
Mm-hmm. You say so many good things there. I remember reading in some research articles around like what the kind of impact that a health scare has on individuals. And that was whether it was cancer or heart attack or whatnot. And I think the article actually was focused on breast cancer and looking at health behaviors and like the how well patients sustain health behavior change after a health scare. And it's amazing that like after the scare, whatever it was, the patients made like remarkable changes. And when we checked in with them 5 years later in the study, they were kind of doing the same thing that they were doing before their health scare, right? The exercise, their nutrition, their smoking, like everything had kind of gone back to where they were at the beginning. And I think what that speaks to is exactly what you were saying there, that like we can get really excited about one or two, very strict things or things that are not particularly sustainable. But when we're talking about supporting patients post cancer, we're talking about like their 10-year journey. We're not talking about detoxifying their liver for 2 weeks.
Right, because I also want people to not live in fear of food. I want people to eat cookies. I want people to have that piece of cake at their son's birthday without worrying that it's going to cause a recurrence. And sometimes some of those diets don't allow for any balance. They don't allow for any wiggle room. It's if you're not doing this, then this bad thing will happen. And we know that's just not the case.
So
But
did sugar feed cancer?
oh, Jordan.
I'm sorry, I feel like I was a setup.
Yeah, I would. No, no, no. That's, I'm just going to leave it there. I'm not, just like you're crotchety about soy, there's certain questions that I'm just like, that's a hard no. I'm not going to argue it. And that's just how it is. Yeah.
Yeah. And I think, and I will, so here's my softer version. This is a good volley back and forth. I think where we get sort of some of that misinformation, and I always like, I'm so empathetic when people have researched this shit out of their condition online, right? Like, let's go back to what you originally said. Like, sometimes there was 120 days in between appointments, follow-up appointments. Like, what is that person doing when they're home by themselves? Well, now they're looking it all up on the internet, right? And they will find someone who ate cottage cheese for 3 months and their tumor got smaller. They will find someone who has drawn out the metabolic changes that happen when a cell has cancer and how much glucose it uses, and then make a statement like sugar feeds cancer. So, of course, right, I have high empathy for people that are looking for help, they're looking for solutions, they want to be validated, and they're looking for guidance. I don't think the internet solves those problems. However, that is what is available to people right now. So of course they go and look at all of that. But that misunderstanding around some of those statements like iron feeds cancer, sugar feeds cancer, glutamine feeds cancer, what we've done there is got so far away from like the actual whole human body. And we're just looking at one cell and how that one cancer cell changes when it has cancer. Yes, its metabolism is high and uses lots of glucose. Yes, there's iron in there. Yes, it uses glutamine fast. But like the whole rest of your body also needs iron and glutamine and glucose, right? And so when we isolate it down to, well, that on a cellular level, this is what the cell's doing, and therefore we will restrict that fuel in the entire woman, we've really gotten away from like thinking about the person as a whole person, which is what that person wants.
Absolutely. And how things perform in a test tube and in a lab are completely different than how things are metabolized in the human body. So it's easy for people to make those leaps, because I also agree too that the internet can sometimes be the only place that's going to listen to them, especially in chat groups and things like that. So I have a mixed feeling about online groups, because there are there's some great information out there from an emotional support perspective, or in small tips and tricks. Like people will say, well, I heard from my dietitian that actually it's okay to use a little bit of honey in water when I'm having mouth sores. And someone's like, oh, okay, well, you used it and you're fine. So there's good things like that, or tips and tricks to really help with, we call it scanxiety. So the feelings that you get before you're about to get a scan. But then there's other things on the internet where there's no regulation. As naturopaths, we're not really allowed to ask for testimonials, but not all other health practitioners have those same regulations. So testimonials are not facts. Anybody can put them up there. And it's really hard for some people to be able to tell the difference between what is actually happening in real life. And I've said that too. I'm like, I'd like to meet some of these testimonials sometimes. So I try to go through the actual research that I have when I'm in office with patients. And that's really that all I can do. But people have to turn to that, because sometimes their other practitioners aren't listening, or don't have time, right? So even though we're speaking about diet right now, their experience when they've spoken to maybe another doctor has been diet doesn't matter, eat whatever you want. And they know in their heart that maybe that's not the case. So they're looking for a middle ground and finding an extreme instead.
That's such a good way to put it, right? Like all they want is validation that like treating themselves as a whole person rather than being laser focused on a couple of cells is important. And what they're finding is an extreme solution that is probably adding sort of like gasoline to the anxiety fire, saying, you know, if you eat a morsel of sugar, you are feeding your cancer, or whatever that, you know, that the version is that they found online. The way I kind of put it with patients, I'm like, it's like TripAdvisor, right? Like people rarely get on TripAdvisor to talk about like their mediocre experience, right? It's, this is the worst place I've ever stayed, right? The chicken gave me food poisoning. And that's often when people are looking for reviews about like even conventional cancer care. They're going to find the chicken food poisoning review. They're not going to find the like, I'm doing okay review.
Right.
Or they get the glowing, inflated, I ate cottage cheese and I've been cancer free for 10 years review without seeing the like thousands of people that didn't work in.
Yeah, I was going to say, it's funny. You say TripAdvisor, I say Amazon, in the sense of when you buy something from Amazon, you automatically get an email 2 days later or a week later. How did you like this? We don't do that with chemotherapy and radiation and then post about it, right? So people have to go on there. And generally, when people want to post reviews, it's not because they had the best experience or because they had the best experience ever. So.
Mm-hmm, mm-hmm. So from a prevention perspective, just to kind of like round that up, like I think what our take home message is like, there are things that women can do, right? We want women to be empowered, to have healthy breast tissue, to feel like their genetics are not a, you know, set in stone scenario. And that there are these modifiable risk factors that we can look at. And funnily, they're this kind of the same answers we talk about with most health and wellness for women. It's the Mediterranean diet, skip the wine, right? Like we're kind of always saying the same thing. And we can't make it sound much more exciting than that, unfortunately. We need to give it a cool name, that diet, but also like to go for regular screening and just the value of that for women that are in that, we call it primary prevention when you've never had cancer before. And we're looking at preventing that first occurrence. But let's talk about survivorship because we have a growing population of survivors. Breast cancer treatment is like highly successful compared to 40 and 50 years ago, which means we have many, many women that are released back into the wild as survivors and kind of left to their own device to figure out how they're going to rebuild their life post treatment. What role do you play for those women? And why is this part so important for you?
So it's important for me because a lot of women, after being diagnosed and going through the main treatment of breast cancer, are also given other medication for prevention. So we call those aromatase inhibitors, and then there's the SERM. So for anybody who knows the drugs, like a tamoxifen or an anastrozole or a letrozole. And those drugs can actually decrease the rate of recurrence by a significant amount. What we see, though, is that sometimes due to the side effects, people aren't able to complete their treatment. So, you know, they're trading, I wouldn't say survivorship, but there's a huge quality of life piece that's missed. And many years ago, when people were diagnosed with cancer, and this can be any cancer, is that afterwards, people feel so grateful, like, oh, I made it through. It's so good. Or you think that your life's just going to go back to normal. But there can be lasting side effects from some of these treatments. And after, I would say, the dust kind of settles and people start to feel well enough to know, okay, I'm past that time, they start caring about their quality of life again. Just being alive is just not good enough anymore. And then they start to notice, yeah, this joint pain sucks. I don't like these hot flashes. My sex life is not what it used to be. I'm having pains where I never had it before. Why am I in menopause? Especially for our younger patients, because people are diagnosed with breast cancer a lot earlier now. So people are being moved into menopause a lot sooner than before. So hot flashes, that can be an issue. And I don't want people's quality of life to suffer. It's not a trade-off for survival as far as I'm concerned. So if I can do my part in not just preventing recurrence, but also helping people manage the side effects of these medications, they have a much higher chance of decreasing the risk of recurrence.
Because they stay on their treatment, is what you're
Yes.
saying. Yeah, yeah. And I think that that's such an overlooked part of their treatment, right? Because like you said, it's like we almost say, well, the benefits of doing the drug outweigh the risk, and so therefore it should just compute. But we're not robots, right? We're not even good at doing the food as fuel thing, right? Because someone invented chocolate chip cookies, and so we have to let our emotions be part of those decisions. But it's similar, right? Like we can say the statistics to patients on paper, like do this, and statistically it's better for you. But that has to like integrate with the way that they're like experiencing their life.
Yes. And when we're looking at the amount of time that people are put on these medications, it's not 1 to 2 years, right? So it's not, oh, just get to the end of 2021 and it's good. This is 5, this is 10, 8, 10 years. So the countdown time is not short at all. So for people who want to travel and have joint pain and can't hike the way that they used to, or worried about going on these long trips, people who want to enjoy sex with their partners, people who don't want to wake up in, cold sweat every night. That's not something that you can just say, okay, at the end of 10 years this will be done. That's a long time to wait.
Mm-hmm. Yeah, it feels like a not fair long time to wait, right? Which I think is why women even start to have that conversation with themselves as to whether or not they want to continue their treatment.
Yeah, I hear a lot. Is this even worth it? Like what's the trade-off?
Mm-hmm. And so what does that look like? Like when you're supporting those women in that window of time, my personal knowledge sort of ends almost at vitamin D status. And so I would love for you to kind of chat about that a little bit, because I think that's a good take home for our listeners who are survivors and thinking about, how do they broach this conversation with their practitioner? So let's talk about the vitamin D thing.
Vitamin D, when we're talking about testing, so naturopaths do have the ability to run certain tests that aren't covered by OHIP, but vitamin D is definitely one of those tests that I strongly advocate that my patients get for a couple of reasons. One, it is going to make a huge difference in terms of some of their symptoms. So putting someone in the optimal range is going to be important from prevention of recurrence, also decreasing side effects, and also decreasing those comorbidities. So vitamin D is very important to me in that. Sometimes patients want to do a ton of fancy tests, and I'm like, if you spend your money on vitamin D, we're going to get a lot further. And I've seen in women just in my practice, sometimes just correcting their vitamin D makes a huge shift in quality of life. The second thing is vitamin D is a fat soluble vitamin, and I describe it as your savings account vitamins. So your checking account vitamins, you take in, you get rid of. It's almost like a little roller coaster. Whereas your fat soluble vitamins build up in your system over time. Unlike your unlike your savings account, though, you can have too much vitamin D, and in those cases, it can become toxic. And with social media and also media outlets speaking, and people like me talking about how important vitamin D is and how it's readily available anywhere, patients are self-prescribing vitamin D. And I don't know about you, Jordan, but I'm not a psychic. So I don't know exactly what someone's vitamin D status is by looking at them. And I've been very surprised. I mean, I've had people who work outside all day with some of the lowest vitamin D I've ever seen. So, and I've had people who are barely taking any with adequate levels of vitamin D. Therefore, I say test, I can't guess, and that's the best way to know.
Yes. Yeah. So like the take home message here is like, don't go buy vitamin D and start supplementing it on your own. You have to get it tested. And I've seen the same thing. And I've worked with patients who have read something online somewhere and they're like, oh, they say the more the better. Right. And have ended up with these like legitimately toxic levels of vitamin D. This comes up in the media every once in a while that someone has overdosed on vitamin D. I even think with like the conversation around COVID, it's come up quite a bit with the importance of vitamin D adequacy, and have lots of experienced lots of patients who were self-prescribing over the last year. And we've had to like go test them and then cut down their levels because they were taking too much. That's such an important point that you say. So when we talk about testing anything, like the shortcut is not to just take it. Right?
Yeah.
It's like, oh, they said to test it. I should probably just take it. No, like the actual answer is to test it. Like if we don't need to test, and I love that you used the word fancy test. I feel like that I'm going to take credit for influencing that term.
Yes, the fancy test is our politically correct way. And with the vitamin D too, there's also just going ahead and taking it. If you are one of the people who don't have enough, taking 1 to 2 drops a day might be doing nothing for you as well, right? So it's just important to know. We really can't guess.
Yeah. Yeah. And I know like the bit of research, and so where I said my personal knowledge stops, is that we know that patients who are on tamoxifen and some of those medications have more joint pain the lower their vitamin D levels are. Right. And so such a simple lab test could literally be encouraging women to stay on their treatment plan longer, which produces better outcomes over the long haul. But that's not part of standard care, right? To have, we don't say, here's your tamoxifen and here's your requisition, let's go test your vitamin D. We're much more reactive about those side effects in general.
Yeah, I've never seen a doctor do that just for no good reason. Maybe, you know what? I shouldn't say that. I haven't met all MDs, but it's generally not, I would say it's not standard of care to have that get tested. And I believe, you can correct me, a long time ago, people were able to get vitamin D tested for free. And I feel like everybody was. And then OHIP said, please stop doing this. And now I find that patients have to advocate quite a bit to get their levels of vitamin D tested, or they'll take the test with me, see they're deficient, and then go back to their medical doctor, and their medical doctor will be like, oh, well, that, I don't know, sure, maybe we'll test it again. But so now I just encourage patients to get it tested with me, especially if I'm going to be the one recommending how much to take, because it's my responsibility at that point. So
absolutely. So part of that like big prevention plan for women that are in survivorship is to help them stay on their medication, or at least help them make really informed decisions about what their options are around their medication. But really, like, and I've said this to my patients who've experienced cancer before, like the greatest role that I probably play in your healthcare is helping you stay on your conventional treatment plan. Now, I think patients have, or women may have the impression that, there's naturopathic doctors and then there's oncology, and those two things are separate and they're competing and they fight. What's your experience been? Because when I say like my entire goal is to help you stay on the meds, we mean it.
I mean it too. I say the exact same thing. So I have actually experienced mostly great things with oncologists, especially when the oncologist knows that I'm coming from an evidence-based perspective and I can back it up. I've called oncologists and had conversations with them. And I also think it's important that when I'm speaking to oncologists, I explain my goals and my role in the person's healthcare, right? So I explain to them, and sometimes that even means having the conversation with the oncologist about the things that I didn't recommend. So, for example, we know that there's some certain supplements that interact with chemotherapy, that interact with radiation, and actually still interact with, your tamoxifen or your anastrozole. And they're very popular supplements that you read about online. So I'll have that conversation with the oncologist that I advise the patient not to take that. And I think that's helpful too, because oncologists sometimes have reflected back to me like, oh, I thought when the patient said that they wanted to do that supplement that was your idea. I didn't realize that you were suggesting that they don't do the Gerson diet. I didn't realize that you were saying, do not get that weird injectable from somewhere else. So I think it's important that all members of the team are on the same page if possible. I also recognize that oncologists are very busy. So it does take some time to connect, but I believe that writing letters or having that conversation is quite important.
Yeah. And I do think that tides are changing, right? As far as what their willingness is to, be part of a more multidisciplinary team. I remember in my earlier years of my career where I was working with more cancer patients, I would convince the patient to go and do chemotherapy because they would come to me with all their papers, right? Because they get all the papers for all the medications. And they would say, what do you think? And I would spend an hour convincing them to go and do it. And then I would say, and I'd like you to take some melatonin. And then I would get the feedback back from their oncologist that they didn't want the patient to take the melatonin and they also don't want them to work with a naturopath. And I would think, well, isn't that crazy? I just spent an hour advocating for your treatment plan and you poo-pooed mine because one time a cow had some side effect with melatonin and you don't want the patient to work with me. But we're going to call that sort of 12 or 13 years ago. And so I do think that the tides have shifted where we're recognizing that we can't just laser focus on the main event of the actual cancer and that the patient's outcomes are better if they do meditation and CBT and yoga and have nutritional support. And really, I think what you've said but haven't said is that patients actually need someone to help them strategically choose a treatment plan that supports their goals rather than some of the extreme information they're going to find online.
Yeah, and that was my experience when I went to radiation therapy school as well. It was just a blanket no, don't do it. And there's been more studies to suggest that patients are doing it regardless, maybe not telling them. So at least if an oncologist can have a conversation with the patient's naturopathic doctor and more people can be on the same team, there's more transparency, more disclosure, more conversations, we can all learn something and that only benefits the patient. But that's better than not having transparency and maybe somebody getting hurt.
Yeah, exactly. So as we kind of wrap up the conversation, Ashley, and I think what you've offered is such a valuable insight around, how women can take care of their breasts and thinking about like that prevention from a breast cancer perspective, but also reminding us that in survivorship, there is the potential to thrive. And I loved the way that you said that, like, you said it better than I'm going to repeat it back to you, but that like, you shouldn't have to trade your quality of life because you got to live.
That's exactly right.
What is your big mission and message for women that are either going through breast cancer, who feel like they're high risk for breast cancer? Like, what's your sort of like passion and goal in working with this population? And what do you want to kind of leave our audience with?
I want people to be empowered. I don't want people to be scared. I want people to be educated. I want people to be able to make the decisions that are best for them, even if it's not having soy. I still want them to understand that, it's safe and that if soy milk happens to come into their vegan brownie, it's going to be okay. I want people to enjoy the time that they have with their families and with their friends. And I want people to understand that there's life after treatment and life after diagnosis. We've made great strides in the medical community. There's been plenty of advances. People are living longer, and I want them to live well.
That's such a beautiful message. I really appreciate you sharing your background and your expertise, dispelling some of those myths for us, because these are ones that we deal with on a daily basis, but maybe haven't addressed completely on the podcast. How can our audience find you?
The best place to find me is to get in touch with the clinic, Clarity Health, and to book a 15-minute meet and greet with me. My bio is up there and my picture. I don't spend a ton of time posting on Instagram. I'm not the meme princess or queen that Jordan is. But I do hang out there, and occasionally I'll post pictures of my dog. It's not evidence-based, but I would say getting a dog is definitely going to make you drink less because they're going to wake up at the same time every day, and you're definitely going to get your steps in. So she's part of my prevention plan.
Awesome. Well, thank you so much, Ashley. And I really appreciate you sharing your expertise, and really what you've done is help us be able to like broaden the community of women that we serve at our clinic, and able to support women all over Ontario who are experiencing cancer treatment or who are in survivorship that are looking to enhance their quality of life. So thank you so much for spending time with us today. We will put the links to maybe not we'll put your dog Instagram links up on the show notes so people can see what your dog looks like, but mostly we will put the information to connect with you, because I think what patients leave their oncology experience with is mostly questions. And what the value of working with someone like yourself is that you have that listening ear that's willing to hear all of your concerns, but also able to help you construct an evidence-based plan that actually holds your goals in the highest regard. And I'm grateful that you offer that to our community, Ashley.
Thank you so much for having me.
I hope you enjoyed that episode of Women's Health Unplugged. My goal is to help you feel more confident about your health. Please remember that what we talked about today in the podcast does not constitute medical advice, nor was a doctor-patient relationship formed. If you have questions about your healthcare or about how today's topic pertains to you, please take it up with your family doctor, your specialist, or someone on your health team.